First of all, thanks everyone for joining us tonight. There's a few stragglers that will be coming in. My name is Phil David, and I'm the Executive Director of Adath Israel. And I just want to introduce you quickly to our panel for tonight. Anna Gindin is our Program Director and just returned from mat leave. We're very glad to have her back. Sarah McGoldrick is our Social Media Coordinator. She's the one that's going to make sure this all works from behind the scenes. And Ashley Waltman is our Education Chair. I'll introduce him with more detail later. And of course, our featured speaker, we're very grateful to have Dr. Ronald Cohn from Sick Kids. Just a few housekeeping items for tonight. This is a webinar, it's not Zoom meeting, so you won't have a chance to see a bunch of squares with you guys sitting in your living rooms. You'll all be able to hear for sure, and you'll be able to ask questions. Those questions you can ask through the Q&A, which is for the most part at the bottom of your screen. And you can send those questions through, and our panel will be behind the scenes putting them together. And once Ronnie finishes his presentation, which will go for about 20 to 25 minutes, then we'll turn it over to a Q&A, which Ashley will moderate for us. I wanted to give a little bit of background about Ashley Waltman. Ashley's been a member of our synagogue for 38 years, which is amazing, but he's also been an educator for his entire life. He started teaching in the mid-70s and has several degrees right up into including his Master of Science and Master of Education. And his last two jobs were at pretty prestigious schools as principal at North Toronto Collegiate and principal at Robbins Hebrew Academy. One of the really nice things about Ashley is that he's also decided to take us up on our offer to come back as our education chair this year. So he oversees the Hebrew School with Dr. Jack Lipinski. And just in time, we wanted to introduce Dr. Ronald Cohn. He's been busy this week because he's given a very similar presentation virtually at Sick Kids earlier in the week, and we're very, very grateful that he's here. Most of you would have seen Ronnie speak about 3 months ago at one of our very first Sunday night series, and so you might have heard this introduction before. Dr. Cohn received his medical degree from the University of Essen in Germany, and after his postdoctoral fellowship, moved to Baltimore, where he was the very first combined resident in pediatrics and genetics at Johns Hopkins. Moved to Toronto, and in 2016 was appointed to the position of the Chief of Pediatrics at Sick Kids and Chair of Pediatrics at the University of Toronto. And since May 1st of 2019, he's been the President and CEO of Sick Kids. Most importantly for us, he's a member of Adath Israel, along with his family, and just as importantly, he's one of the key members of our Medical Advisory Committee. And we've counted on Ronnie countless times over the last 5 months to help us with our decisions to try to keep our members safe. So with this, I'm going to turn it over to Ronnie and ask the panelists to turn off their videos and mute themselves. And over to you, Ronnie.
Thank you so much, Phil, and welcome everyone for joining us today on what is clearly the dominating topic of our conversations these days. And before we'll try to answer your questions to the best of my knowledge, I'd like to take a few moments and provide you with a bit of an overview of where we are today. And I will make a few important comments that I hope will shape our discussion tonight. So I'd like to first start with, why are we even having this conversation tonight? Why is it so critical for us to find safe ways of sending our children back to school? It goes really back to the beginning of May, when we as a scientific community realized that COVID-19 is not going to go anywhere anytime soon and will stay with us for a long time. And I don't know for sure how long this is going to be, nor does anybody else know. But it's safe to assume that it will be with us for at least another year and likely much longer. It was also at that time when we began to see the impact of the pandemic and the necessary lockdown that was put into place back then on the physical and mental health of children. And I want to give you a few examples and data around this, because I think it's sometimes lost in our current conversation. Early on, we received data from China, Spain, and Italy that suggested that a large proportion of children have increased symptoms of anxiety, depression, and irritability because they were also isolated for a very long time. Closer to home here in Ontario, there are also troubling data now emerging. A recent survey by the Children's Mental Health Ontario found that 1 in 3 Ontario parents reported that their child's mental health has deteriorated from being home from school And more than half of the parents notice behavioral changes in their children. And these can range anything from serious changes in mood and behavior to difficulty sleeping. And obviously, all of these issues are amplified in children with pre-existing mental health conditions, of which we have 40% of children here in Ontario. Children need routine, and they're currently missing out on physical and social activities that come along with school, such as recess or physical education. They are spending an exorbitant amount of time in front of screens, using social media. Their sleep routines are affected. There are many children who are not spending much time outdoors. All of these health behaviors will eventually affect their growth, their development, and their overall well-being. Schools do offer a very important and needed environment which optimizes child health, learning, and well-being. We are also particularly concerned about the disproportionate impact of school closures on disadvantaged children and youth and adolescents who may rely on school for food security. This may not necessarily be the children in our community, but there are many children who rely on school as a safe place away from potentially family discord. But we also were noticing that this pandemic was having an impact on the physical health of children. I just want to give you a couple of examples from our own hospital. Between March and June, we saw a significant reduction in visits by 45% as compared to last year. At the same time, we saw a significant increase in the acuity of patients arriving to the emergency room. So kids arrived with much more severe symptoms for certain conditions than the year before. And on top of this, we saw and are continuing to see an increase in injuries that are mostly associated with prolonged time at home without adequate supervision, things like accidental burn injury or scalds. We don't yet have the data here in Canada, but from the United States, we know from a survey of over 1,000 pediatricians that just 2 months into the pandemics, the vaccination rates decreased by 50%. So I think this is the reason why we are having this conversation and why we need to find the most safe and healthy way to get children back into school, recognizing, and this is very important, for the entire evening and the weeks ahead, that we will be balancing and mitigating risks, but we won't be able to eliminate the risk from infections, which is like everything else we are doing once we leave our house. Before I speak more about these mitigation strategies, lots of questions about this. Which is from 3 years ago. And I think let's tackle this with 2 different questions. First, what's the risk of kids getting infected from the novel coronavirus? And what happens if they actually get infected? So let's tackle the first question. So far, about 5 to 10% of symptomatic infections involve children.
Ronnie, sorry to interrupt. Some of them are asking you to speak a bit louder if possible.
Okay.
Hey, thank you. I'll turn myself off.
At Sick Kids, by the end of July, we have tested 10,103 children and found 74 positive cases. That's a positivity rate of 0.7%, which is significantly lower than the population averages. And overall, the general thinking is that children, particularly the younger children, the risk of getting infected is lower than adults. However, there is still some debate among scientists on this, as children have been largely sheltered due to school closures and also have not been tested as widely as adults have, so we are continuously analyzing these data. As for the second question, even though we are still learning new information about the way the virus affects humans, it's fairly clear that children are much less severely affected. This is one of the very few silver linings of this pandemic. First off, children are more likely to be asymptomatic than adults. And if they do get symptoms, they tend to be very mild. Things like severe lung disease, similar to what we have seen and what has been described in adults, is thankfully extremely rare. Again, from a sick kid's perspective, as of the end of July, we admitted 15 children who had positive tests for the virus, most of whom were admitted for reasons that had nothing to do with COVID-19. And most importantly, all of these children have done well. Throughout Canada, there has been only one single death in a child, and I want to make sure that everyone understands this because it's misrepresented in the media. This child did not die of COVID-19. It was an accidental finding. So as of today, we do not have a child in Canada that died of COVID-19. A second manifestation that many of you have probably been reading about in the media is called the multi-system inflammatory syndrome. It's an interesting phenomenon because pediatricians around the world began to observe children with evidence of an inflammation affecting multiple different organs that generally occurred 3 to 5 weeks after a surge of COVID-19 infections in the community. At the current time, the thinking is that the virus is triggering an immune response in a way that is somewhat similar to other conditions that can cause prolonged fever and inflammation, like a disease called Kawasaki disease. We have admitted about 50 patients for investigations of the syndrome, most of these children, interestingly, in May. We admitted a few of those for a brief period of time, and 2 had a very short stay in the ICU, but all these children responded extremely well to therapies and are all doing well now. So now let's talk about one of the controversial issues, which is whether and how children transmit this virus. Just like the question of the risk of getting infected, there are data that suggest that children are less likely to transmit the virus, and that's especially true for the younger children. The main reason why this is so highly controversial is because this is not at all what we expected when the pandemic began. There are many infectious diseases where children are important vectors of transmission. We see this for head lice, impetigo, measles, influenza, really lots of infections, and most of these infections are transmitted by droplets. But for this virus, we haven't seen this happen to the extent that was expected. There are now 20 million cases in the world, and it is pretty clear that to date, children are not the major drivers of this pandemic. There certainly have been outbreaks, but most have been very small and well contained. Larger ones, like the one in a high school in Israel, have gotten substantial media attention, but it does seem very clear, and I'll speak to this in a moment a little bit more, that children are more likely to get the virus from an adult than the other way around. And certainly many, many countries by now have successfully reopened schools without any substantial evidence of transmission by school children. Now, I want to make a few important comments here. Even if it's true, or if it holds true that children have much lower risk of transmission than adults, this is likely mainly true for younger children, not so much for the older one, specifically the adolescents, high school students. And there is no magic age of cutoff, though. Second, and probably most important, a lower risk of transmission does not mean that children cannot transmit it at all. So there's a very fine line here, which is very important as we move forward. So let's talk about a little bit of how we're going to safely open school. And I'm not going to go in detail through all of these measures because I'm sure we'll be talking about this during the question and answer period. But let's talk about a few important things. First and foremost, this starts with you. It is now the time, more than ever during this pandemic, that we as a society and as individuals have to make very smart decisions about what we do and what we don't do in our personal life. We absolutely need to remain vigilant and keep community transmission low. If we can keep our daily numbers in Ontario around 100, then I'm very confident that the opening of schools will be successful by and large, especially in areas where we currently don't see any cases. So I'm pleading to all of you right now to continue to be careful and really be smart and careful about the decisions you make in your own social circles. And I want to just provide you some perspective on this. Many countries in the world who have opened schools have looked for benchmarks of what's the magic number of community transmission. And there are really two numbers that countries are using. One is the positivity rate of a corona test virus that needs to be 5% or less. Now in Canada, our positivity rate has been 2.5% since the beginning of the pandemic. Right now, it's 0.5%. Another benchmark that other public health officials in countries are using is to aim for less than one case of coronavirus for every 100,000 people, which indicates usually very little community transmission. Practically speaking, here in Ontario, that would mean we need less than 250 cases. And as I mentioned before, right now we are hovering around 100. So we are in a very good state right now, so let's keep it there. Second, and some of you may have read in our Sick Kids Guidelines, and by now there are many other guidelines published, we absolutely have to put a lot of these mitigating factors in place in order to reduce the risk of transmission of the virus. School will have to look different, that's for sure. And while I don't want to go through all of these strategies in detail, I do want to emphasize one absolutely critical point that's almost always missed in our current discussions in media and society. And that is the only way how we will be able to successfully mitigate the risk of transmission in schools is dependent on implementing as many of the mitigating strategies as possible. It really is the bundled approach here that will define the success. We can discuss the masking of every individual in a school wearing it all day long, for all day long and all week long. If we don't implement all the other important strategies, hand hygiene, which is another topic that's completely lost in our discussions, physical distancing, etc., then this will not go well. So again, it's the bundled approach that is necessary to lower the risk of transmission. And this, by the way, is the main reason why school openings in some schools in Israel were a disaster. I've had several conversations with the Deputy Minister of Health in Israel and other representatives from the Ministry of Health in Israel, and they all confirmed that the schools who had major outbreaks were the schools who in fact ended up not implementing any of the necessary strategies in the context of rising community transmission. There were a number of schools in Israel who stayed open successfully, although the community transmission was rising. Again, these were the schools who implemented a bundle of safety measures, so we know it can be done. I do, however, want to point out one aspect of this strategy that I think will require a significant change in our societal behavior. And that's also not much discussed publicly, and that is the screening for our children before they go back to school. Under no circumstances can we do what I think is fair to say we all have done here and there, which is sending our children to school when they are not feeling well. And that, by the way, is also crucial for all of you when you go to work. If you do not feel 100% healthy, then please do not go back to work. I know it sounds simple, but if you ask yourself honestly, when was the last time you stayed at home when you didn't feel well? I think most of you would say I have to feel pretty bad before I not go to work. And the same is often true for children. So we have to go through that behavioral change. Now, I will say, and it's very important for everyone to recognize this, we will see cases in schools, and we may even see schools closing for a day or a few more days. This is expected, and it's not, it should not be seen as a failure. There will be a lot of support in place for schools who may see a positive case, and a number of strategies around testing and tracing will help keep this under control if a school is labeled for having an outbreak, which is another unfortunate dramatic word. And I want to again provide you some perspective on this. In a long-term care facility, one positive case meets the definition of an outbreak. In a hospital, it's 2 or maximum 3 cases. So we do know that there will be a very low number that will define an outbreak in school. Before we start answering your questions, I'd like to make one last comment. The topic of sending kids back to school has clearly dominated the discussion in our society, media, and social media over the last few weeks. And it will continue to be a very hot topic as fall and winter approaches. This is clearly a topic that touches a nerve for many. And the feedback isn't even consistent. I sat on a recent panel at a school and looked through the questions which range from, how dare you open up schools in the middle of an unprecedented global pandemic, to, how dare you recommend masking for my child? But when I take a step back and really think about it, I think this simply reflects the times we live in. I recognize that this is a very difficult time for all of us, individually and as a society. And I think it's fine to accept that we are all just a little bit scared. We're scared of the disease. We're scared of these public health measures we need to take to fight this disease. And I think most of all, we are scared of the uncertainty that this will look like in the coming months, how this will look like in the coming months or years. However, the recent politicization of this topic of sending children to school is disappointing, to say the least, because it creates a lot of anger, which then in turn leads to an even increased level of anxiety that is frankly unnecessary and counterproductive. I think it's important to not focus on whether we send our children back to school, but rather focus on what is undoubtedly critical for the development and future of our children, as in sending them back to school. In the end, I'm very optimistic. All pandemics in human history have ended, and this one will pass too. So let's try to answer your questions.
All right, so I'm going to ask Ashley to come back on as the moderator, and I see a lot of questions coming in through the Q&A, so Ashley, we'll turn it over to you and to Ronnie.
You just spoke just a couple of minutes ago, about the anxiety, and students always have anxiety coming back to school. So how do parents, and also the media has really heightened that anxiety. So what advice do you give to parents on how to help their children deal with this prior to going to school with, and when they walk into school, there'll be masks and social distancing. So it's going to be very anxious for students. So how do parents help them?
So I think it depends a little bit on the age of your child, but no matter at any age, you need to have a conversation with your child about this. And if you think about it, kids already understand that they have to wash their hands, that they have to put on a mask when they go into the grocery store with you, that they have to physically distance. Many of your kids have been not hugging their grandparents for months and months and months at a time. So I think what's critical is that you explain to your children, school will look different, undoubtedly different. but then try to emphasize the positive aspects of school. Because most of the kids, at least the ones I speak to, including my own son, they miss school. They miss their friends. So I think if you can try to create this balance between, yes, it will look different, and everybody will try to make sure that everything is as clean as possible, that you stay away from each other. I think we can believe in our teachers, all of our teachers, that in the end, they will do their best to make this the most joyful environment for all the children.
Great. Ronnie, if a student is, the child is symptomatic, having some of the general symptoms we hear about, do they need to be tested every time? And I know public health has been telling people that even if it's positive, they should be isolating for 14 days. What do you suggest about that?
So in the beginning, if your child has any kind of symptom that can be associated with COVID-19, which is pretty much kind of any symptom, your child needs to get tested. When the test comes back negative and the symptoms of your child are improved, then we will get soon some public health guidance on this, but the public health guidance will then direct the school that if you have a negative test, you don't have symptoms, you can go back to school. That's at least the current information. By the time school opens, each school will have very close directions from public health. So as of today, that's the way how it would go. If they change their mind, your school will know and will let you know.
Oh, this is a question that came up actually at our meeting the other night. How do you deal with a situation where a teacher tests positive or a student tests positive or an immediate family member of the teacher or the student tests positive? How should schools be dealing with that?
Can you repeat the question? I lost your connection in the middle.
Sure, sorry. If a teacher or a student tests positive, how should the school deal with it? And also, if an immediate member of the teacher's family tests positive or an immediate member of the student's family tests positive, how should that be dealt with?
So there are very clear public health guidelines in place for this. I don't know whether anyone who is listening actually had COVID-19, but if you are tested positive, then public health will call you and then will establish a very clear pattern of whom you have been in contact with, what this contact consisted of, which means if you just have been with in contact for less than a few minutes, if it is somebody who lives in the house with you, then these individuals will have to get tested. So they're very, I want to try to reassure you, I know there's a lot of criticism about government, public health and whatnot out there. There are very well-functioning public health units in all of the GTA. If somebody tests positive, then there will be a very rigid testing and tracing strategy in place that will help deal with this.
We have a question about if we're being short-sighted, setting our students up for a lifetime of chronic and potentially threatening problems in the future, and if it's going to be potentially affecting their immune system. So the long-term effects of COVID on young students.
So truth is, we don't know the answer to this. But again, what's currently being discussed in the media in terms of the long-term effects on adults, let's put this in perspective. We have known this virus for 8 months. In North America, we have known this virus since March. So when we talk about long-term effects, what people are currently discussing is that adults who have had severe COVID-19 disease take a long time to recover. For children, we really don't know at all whether there are any long-term effects. Just because they have an immunological multi-system inflammatory disease 3 to 5 weeks after may be exposed to COVID-19, that doesn't mean necessarily that this will have long-term impacts on any of their organs that were affected. But let's now take this to the other extreme. In order to know whether a disease has long-term consequences, we will need years to figure this out. So we can't isolate ourselves and or the children for years.
Okay, Ronnie, a lot of it seems like we have a lot of grandparents on this webinar, and they're asking how do they interact with their grandchildren who attend school? If they're presently in the bubble, should they drive the child to school? Should they, look after the child? What is the effects on grandparents?
You know what? This is a really challenging question. And I think it's a question that many families are struggling with in their decision-making about sending their children back to school. I also think this is another issue that disproportionately impacts marginalized families, by the way, who may be living in crowded, multi-generational housing. And I don't know how many of our members are living in situations like this. But let's go back to the basics. If community transmission stays low and the appropriate steps are in place to mitigate the risk in school, I would hope that the risk for any kind of vulnerable member in your family, whether these are grandparents or maybe even some parents who are immunocompromised, the risk from getting sick from opening school remains very low. Unfortunately, though, the risk cannot be zero. Even if the children didn't go, though, back to school, any family member can potentially bring the virus home. Steps that can be taken to mitigate this risk would be similar to those that are being recommended right now by public health, including minimizing the number and duration of interactions in closed indoor spaces, maintain the physical distancing, hand washing, etc. I would also hope that school boards pay particular attention to their schools in their neighborhoods in which the risk is highest. So if your child is going to a school where the community transmission is higher, then maybe you as grandparents need to be a little bit more careful. So it is a tough question, and I know I didn't give you a 100% answer because there are very many questions there is no clear answer. But I think with low community transmission, maintaining some of these public health recommendations, I think you're probably safe to continue to see your grandchildren.
Okay, great. My wife will be very pleased to hear that. We have a lot of our children are in multiple programs. They go to regular school, then they can go to, hockey if it starts up, or ballet, or Hebrew school, or any other program that they go to. So there's a lot of mixing going on. What's your comment about that?
Yeah, so I think that is a problem. And that's another problem that we're not discussing much. And we don't really have a clear recommendation for this other than at the moment we would recommend that you try to limit the after school activities to really the activities which are most important to your child. And whatever those activities are, you need to make sure, whether this is ballet dancing, hockey, there are currently discussions going on how and if that can even happen, and even after school settings, all of these settings need to have mitigating health and safety measures in place. If they don't, then I would not recommend you send your child there.
The prestigious pediatric journal JAMA apparently states that clearly that children under 5 have 100 times more virus in their nasopharynx area and that children under 5 transmit as easily as adults. And this seems to contradict what Sick Kids is saying about children as transmitters. Comment?
Yeah, so this is, I don't know, I don't know whether the person who's asking the question read the paper very carefully. So it's true, children seem to have a lot of virus concentration in their nose. That doesn't necessarily translate into transmission. This paper in JAMA does actually not speak about transmission. We are extrapolating the finding from this paper to these children transmit as much as possible. That's why this remains such a controversial issue. We also have to go back to the other studies. I'm sure the person who is citing the JAMA paper has heard about the South Korea study, where there was this arbitrary cutoff between 2 and 10 and 10 and 19 years of age. And these data were completely wrongly interpreted and had to be reinterpreted several weeks later. So I think we need to be careful, and I don't want to come across as being stubborn here, but we have had 38 highly educated academic people analyzing these data. And right now, it doesn't seem that children transmit the disease at the same level as adults do.
Masks for students, the
Waiting for the
ministry.
last question.
Yeah, you knew this coming. Students, the ministry says students in grades 4 and up should be wearing masks. What's your feeling about that in terms of the younger students not being required to wear those masks?
So I will tell you that that was the most controversial aspect of our document. Like I said, we had 38 pediatricians, infectious disease specialists, and other academics working on this document from all the children's hospitals, actually. I know it's always the Sick Kids report, but it's really all the children's hospitals who worked on it. And we could not get agreement on a recommendation for masks. So where is the disagreement or the controversy coming from? It's about the practicality in young children. 85% of my colleagues felt it's impractical for elementary school children to wear a mask for more than an hour a day. And the people who are making the argument, you have a whole part of the world population in Asia where children are wearing a mask from the age of 2 or 3, and they make the argument children are going to get used to this. I don't know where the true answer is. Our government has extended our own recommendation, which was initially just for middle school and high school students to grade 4 and up. The TDSB is now mandating masks for all children at any age. And I'm going to give you my pragmatic assessment of this. It's going to sort itself out. If you want to mask everybody who's going to class, and the children are going to start fiddling around with this, and you have soiled masks flying around in the classroom, which then in fact could increase the risk of any kind of potential transmission, we'll change our approach. And maybe they're just as resilient as many people say. I really don't know. I think what I am concerned about when it comes to masks is if you can create a classroom where you have at least 1 meter physical distancing in between the children, then take off the mask, because what we do in our society, teachers, kids in our society, we talk a lot through facial expressions. And these are lost when the teacher and the students are wearing a mask. Some of the children, even of our own children in our community, grow up bilingual. If they can't see the lip movement, and English is not their first language, or it's French or Hebrew, it's going to be significantly more difficult. So I'm probably more worried about the learning impact than the health impact. But let's be pragmatic about it. I have to say, if this is what's going to calm down society, that we have to mask all children, then let's do it, and let's just be flexible. The other point I forgot to make earlier, we have to remain flexible. I can tell you, since March in our hospital, we have changed rules sometimes every other day. New evidence emerging, new things that we learn. We thought they're going to work like this, but they don't. So flexibility is a strength. And what worries me with this current heightened anxiety is that if we see that something is not working as we think it should be, and we have to change it, then everybody's going to get all anxious and upset about, oh my God, we did something wrong. No, I think there are certain things in place, how we start. And as we go along, we will have to change certain approaches. And that will be true for mass. We'll see how it's going to go.
Getting some questions about surface spreading. Whether you go to the kindergartens where they're using toys and manipulatives and sharing those, and then even with older students, bring books and things like that home. Do they need to be cleaned? In the same way that groceries are. Can you just comment about surface, the idea of a surface spreading?
So it's a really good question, and we do recommend cleaning of toys and books, and most importantly, though, trying to not share too much of toys and books. The truth, though, is the virus, while it does survive on a clear surface, whether it's plastic or metal, the area where it mostly survives on is the inside of the mask. So come back to the mask issue again, but I think what's important in terms of surfaces is that when you take off your mask, make sure that it's disposed well, and that is something you can teach your children. Wash your hands before you take off the mask, after you take off the mask, and put it in a safe place that the soiled mask is not going to touch lots of surfaces, because then you increase the concentration of potential contamination.
Some questions about some of the daycare and for younger students, and how safe is it for children 2 and 3-year-old students to attend pre-nursery in a class where there's 12 students and 3 teachers, and they're of course not wearing masks?
So it's a good question. There are two thoughts about this. Number one, we do have a lot of daycares that are open. They have been open throughout the summer, and even at the beginning of the pandemic, because some of the essential workers had to send their children to daycare. While I know there were 2 outbreaks recently, by and large, these have gone very well, because the teachers who take care of the children wash their hands, have other mitigating strategies in place. And the areas where we had the school outbreak were the areas where the community transmission was high. So you need to look at your local data. They're available at the Public Health Ontario website. And if your community transmission is low in the area, then the risk of the teacher or the daycare provider infecting the children is much lower. I'll give you one very personal example, because a colleague of mine had their 2-, 3-, and 5-year-old child in a daycare where this outbreak happened in June, I think it was. One of their children was positive, the youngest, and nobody else got the disease from this young baby. They had to take care of the baby. So again, it's speaking a little bit about the transmission of children, which is still to be figured out.
Ronnie, how many, for an elementary student who'd be in school all day as opposed to the high school students, how many masks would you suggest that they bring to school every day, and how often should they be changing the masks?
So I would suggest 2 masks per day. And it really depends on whether they're going to soil their mask. It's probably sufficient to wear 1 mask a day. Now, you need to teach your children that if they sneeze into the mask or if they speak into the mask, and some children may have a lisp or may have a more watery speech, that if it gets wet, then they need to change it. But more than 2 masks, that's probably all I would do.
Okay, great. Ventilation is an issue. There's been an article in the Toronto Star recently about it. What kind of questions should parents be asking the school, or what kind of issues should they be looking for?
So here the most important question will be first starting with, is it a very old building your child goes to, or is it one of the newer buildings? We do have a number of schools in our city who are actually newer buildings, and most of those have air ventilation systems that are just sufficient. Now, there is quite a bit of money coming to at least the public schools, specifically for the older public schools, to help with the ventilation. I think one of the most difficult questions around this is whether the classroom of your child will have a window that can be opened. Because what I've learned in speaking to by now literally hundreds of parents and teachers over the last few weeks, there are actually some buildings in our city, in school buildings, where the windows cannot be opened. So here you need to ask the question. There are portable ventilators that are now being purchased and distributed. And this is something I would ask the question, whether this is a classroom. If you cannot open the window and you have an old school building, you should at least ask for one of these portable machines to be in the classroom.
How can teachers really very well protect themselves, especially a teacher who's teaching very young students who's, may sneeze all over the teacher, hygiene isn't developed, the hygienic skills. How can a teacher protect themselves? Of course, they'll be wearing a mask.
Right. So, I mean, all the teachers will be wearing a mask. There is, and we have discussed it in our document, and I think what I've learned now, a number of the elementary school teachers or the teachers who work with younger children put on a mask and a face shield. So the face shield really is just going to protect your eyes. And I think if you wear a mask and face shield and really practice very good hand hygiene, your risk is probably much lower than is currently being discussed. I do recognize, I want to make it very clear here, I do recognize this is very challenging for teachers. And I say that because I know what we had to do in our hospital to make our hospital safe for our staff members who were as worried as you are now as teachers. And at the end of the day, we are healthcare providers. So if it's challenging for us, I know it is 10 times more challenging for you. I mean, that was in the end the impetus for us to provide these guidelines, and why we are now having 500 public health nurses that will be deployed, and why we are now putting all the hospital sectors actually together to help support schools. Still, I think with a mask and potentially a face shield and washing your hands and not touching your face before you wash your hands, I think your risk of being infected from a child is very low. Your risk of getting infected from potentially a family member who has to go to work and is going to be exposed to other people is still going to be higher.
earlier you mentioned about the ventilation machines. Where can they be obtained?
So the government is helping schools to get those.
Okay. I presume that Doug Ford and Stephen Lecce aren't members of the shul, so they're probably not on this. But sick children recommended class sizes under 15, but that's not going to happen. What's your feeling about that?
So first of all, I want to correct this because we did not recommend a cap of a class size. What we did recommend is that no matter how many children you want to put in a room, they have to be distant by at least 1 meter in the young children and 2 meters in the older children, meaning middle school and high school needs to be 2 meters and the younger children 1 meter. So I actually have spoken to a number of public school teachers where they can put 20 children into an elementary school with 1 meter distancing. So this number of 15, 12 to 15 comes from countries like Denmark and Finland and a couple of other countries where they have reduced the class size. The key here is the physical distancing. And I want to make it very clear, and I've made it clear in the document, in the media, physical distancing is critical. If you cannot maintain physical distancing, then you need to put on a mask.
There's going to be a number of parents who decide for various reasons to homeschool their children or keep them home and wait for the video from a school. So can you comment about what parents should do or issues they should be looking at for looking at the mental and physical health of these students and how they can support them?
Yeah, so I do think that the online curriculum in general will significantly improve because there are a number of parents who, for various reasons, do not want to send their children back to school. Because first it starts with, what does an online curriculum look like? I know that some of the private schools during the first phase of the pandemic have done very, very well with online schooling, and many of the public schools didn't have the resources to make this happen. So I think that will change. I think what's really critical is for you to think about, are there any opportunities for some social interactions of your child after school with other children? That may be difficult depending on the age, because here you need to maintain physical distancing, and it could very well be that some parents say, I want my children only to be with the children in school, and that's their bubble, and I don't want any other child. But I think there are opportunities how children can interact outside of screen. What I'm so worried about, what we are worried about, is that children have to sit in front of the computer 5-6 hours per day with online, quote, life learning. And then they're going to start interacting with their friends on an iPhone or iPad, which means practically 8 hours of screen time every day for the next few months.
Washrooms are an issue because students from various classrooms, you may want to try and keep a cohort together, but that's going to be breaking down when it's breaking down for a couple of reasons. One, when the students go to the washroom. Also, if you have teachers who, let's say, teach phys ed, so they might teach, X number of classes. Those kinds of things, are the cohort breaks down. What's your feeling about that?
So it's really two questions. So the bathrooms, every school I've been speaking to will clean their bathrooms regularly, and they will make sure that you only have a certain number of students at one time in the class, in a bathroom, so that you don't have like 6-7 children in the bathroom at any time. So you need to ask that question to your school. Each school does it differently depending on the bathroom size. I mean, something I've learned, which I cannot even believe, is reality, is that some of our schools didn't even have had soap and hand washing stations in a bathroom. How that can happen in Ontario, I don't know, but apparently it does. So all these things have been fixed or are being fixed right now. So the phys ed teacher teaching different groups of students, there are various different solutions that schools put into place for this in order to keep the cohorts of children low. And some schools are even opting to significantly reduce or eliminate physical ed in the beginning. So you need to ask your school specifically the question of how they're dealing with this.
You mentioned that the teachers, and the question that I asked or through me from one of the participants about teachers protecting students, and you talked to protecting themselves rather, and you talked about wearing a mask and a shield. Are you suggesting that might be something to use for students as well?
The question is whether kids should be wearing a mask and a face shield?
Yeah.
And no. So that that I think is a very bad idea. And I'll tell you why. So first of all, what's the reason for the face shield? Mainly is to protect your eyes. Now there is a small benefit for children or for individuals who just wear a face shield for potentially transmitting the virus. It's significantly lower than wearing a mask. And if you really want to have a face shield that protects transmission, then you have to have a visor that goes really around your head. But as I told you earlier, we already have some practicality concerns around the mask. So now let's take a 5, 6, 7-year-old child with a face shield. How are you going to transport this to school? Who's going to clean it if one of these kids is going to sneeze into this or is just going to spit into this? Are you going to take it out of school? That is completely impractical, and that, I think, is a higher risk than not wearing anything. I know it's being discussed, and it could very well be that a recommendation will come out around this, but here we have uniform agreement among our 38 pediatricians that that's a bad idea.
I just wanted to interject. It's 8:30 now. Why don't we take 3 more questions? Because I know, Rhonda, you wanted to wrap up as well at the end.
Sure.
So, Ashley, over to you. Let's do our final 3.
Maybe the one thing I want to offer, I do see there are a lot of questions, which I know I can answer them all. I don't know how many of them are similar. If
I've tried my best to try and group them.
No, I bet you did. If there are questions that are important that I didn't answer tonight, send them to me via email and I'll reply to you.
Beautiful.
Amazing.
Will physical distancing that's going to be in effect at schools, do you think it's going to affect the students' ability to socialize with others and their ability to socialize, period, in our society?
Well, the answer is yes, it will to some degree, but I think that we will have to get used to this. I mean, you know, there's physical distancing of 1 meter and 2 meters, and then there's physical distancing, which has been practiced for 2 weeks in France that was 3 to 5 meters. And I'm not sure how many of you have seen these sad pictures of kids sitting in a square so far away from each other that it was already heartbreaking. So I think maintaining physical distance of 1 and 2 meters is difficult, but I think that's probably doable, at least for the older children.
If there is a child who has a medical condition that they cannot wear a mask, what do you suggest? Face shield? Nothing? Speak to the school? Like, I don't know how anybody's going to handle that.
So I think it's very important. Obviously, as somebody who works at Sick Kids, I'm really worried about every child right now here in the province, but these are obviously the children we are extremely worried about because we do have some children who, for various medical or even mental reasons, cannot wear a mask. And that needs to be accepted by the students, by the teachers, by the schools. Keeping in mind what I said earlier, it's a bundled approach. So if you have a child who cannot wear a mask, as long as you have all the other measures in place, and in this particular case, specific focus on hand washing, it will be just fine. We need to make sure that these children are not disadvantaged in going back to school.
Before the last question, Dr. Cohn, if you could give your email address, you suggested that people send you emails.
Well,
Yeah,
why don't we send it to Phil?
Yeah, send it to me and we'll consolidate them and send them back to Dr. Cohn.
Okay, then the last
Which is-
question is, in schools, there's a lot of professionals who go to multiple schools. You could have a special ed consultant. I understand there's going to be less of those as they're trying to have them come into schools. It could social workers, psychologists go to various schools. I mean, they could be a transmitter. How do you feel about that?
Yeah, so we actually have made a comment about this. We're going to have to reduce the amount of multiple school interactions of staff members or teachers. This is something that schools have to figure out, and I think a number of these new teachers that are actually being hired now are being hired in order to reduce having one teacher going to several different schools.
Thank you. I guess that's the number of questions. I've tried my best to try and include as many as we could, and I do apologize to people whose questions weren't answered. But again, if you could relay those through Phil, who will be Dr. Cohn. Thank you very much, Doctor.
Well, thank you. Just send me the questions, and let me just end with telling you thank you for all these terrific questions. They were as tough as expected. And like I said, send the other questions to Phil, and I will do my best to get back to you and support you and your families as much as possible during these, for sure, challenging decisions you all have to make. So I'm the first to admit that there are a lot of uncertainties ahead of us. But the one thing I do know is that the only way, and really the only way, we will be able to get through this is if we all work together and if we all listen to one another in a civil and respectful manner. I apologize about this. There has never been a time in history where anger and unnecessary heightened anxiety led to a positive outcome of anything. So let's make it happen as a society. I know we will, and I know we can, and I know we will in the end prevail here. After all, our children are the future of our society. So let's not forget this and make sure that we are paying attention to and also listening to our children, which are a little bit the unheard voices of this pandemic. So I wish all of you a good end of the summer, and since I won't probably see most of you, Shana Tova Metuka, and all the best.
Right. Ronnie, as Ashley said, thank you very much for your kind words. Thank you very much for taking the time. I know how busy you are, having just done something like this earlier in the week, plus your job at the hospital and as a dad at home and on our medical committee. I know we're keeping you busy, so we really do appreciate it. I wanted to give everyone my email. I've gotten a lot of emails over the last week in preparation for this. So it's Phil, P-H-I-L, @AdathIsrael.com. To make it easier for me to group these, if you don't mind, in the subject line, just put Dr. Cohn, C-O-H-N, Dr. Cohn question, and then I can consolidate them easily over the weekend after Shabbat, and I can consolidate them and send them over to our wonderful doctor. We did tape this, and we'll get this up on both our website, on one of our sliders, and it's also on YouTube. So more information will be coming about that tomorrow. I also wanted to let you know that the high holiday communication is coming out tomorrow. We've been working on it for the last several months, but specifically the last couple of days, and we're just about set to send information about our services and how you can participate, both in service with limited seating and also with live stream. And just as an end here, I introduced Anna Gindin earlier on. She's our program director. She wanted me to pass on A couple of notes about some upcoming programs. So Ronnie was gracious enough way back in the spring to start off, at that point, our Sunday night series. And he's been gracious enough to start off our adult education speaker series as we approach the fall. Coming up over the next couple of weeks, we've got a movie on September 8th at 7:30 p.m. Obviously, these are all virtual. My grandparents had a hotel. These are on our website and in our Akshav, which comes out every Tuesday and Friday. Really interesting speaker, Barry Weiss, who just left the New York Times. She's going to be speaking with us on September 10th, also at 7:30. We'll double check at 7 or 7:30. And the title of her presentation is We Need to Talk. But just like tonight, a lot of it is really about Q&A. And finally, we wanted to let you know that there is an amazing program being planned, a drive-through event in our parking lot to experience Rosh Hashanah from the comfort of your car. And much more information will be coming out about that over the next few weeks, but it's already in our Akshav. I want to thank Anna for all the programs that she's starting to put together. Thank you for joining us on a Thursday night. And again, to Dr. Cohn, we are so grateful for all of your time. Everyone have a terrific night.
Thank you.